Thanks for staying with us. Now, in June this year, the Ministry of Health released a home-based care guideline with the criteria for selecting those suitable for it. Let's take a look at who qualifies for COVID-19 home-based care. Let's take a look. Now, asymptomatic, rather laboratory confirmed COVID-19, meaning you must have tested positive for COVID-19. Also, patients must be stable enough to receive care at home, meaning they should have very mild symptoms, if any at all. There should also be absence of underlying conditions, and the elderly are unlikely to be suitable for home-based care. A patient must also have a home that is conducive for treatment. A caregiver must be available, and there must be access to food. Now, some people that have tested positive for COVID-19 are being cared for by professionals who come to the house, but there are some new questions tonight about the process now that we are battling this invisible enemy. Patricia Namu Mukayagi is the CEO, Visiting Angels Nursing Agency Limited. And also on the show tonight is Dr. Daniela Munene, who's the CEO, Pharmaceutical Society of Kenya. Good evening, ladies, and thanks for being on the show tonight. I'll start with you, Patricia. What is home-based care, and what are carers essentially supposed to do?
Thank you, Lillian. Good evening. Home-based care is also called home health, where we are offering health services at home. And this is not only nursing, it is includes also doctor's visits, it includes physiotherapy, it includes occupational therapy, we have physiotherapists, we have wound specialists that will come to the home. And the purpose or the objective of the provider who is coming home is to promote healing, to support the healing of the client. We call them clients, we don't call them patients. But yes, for purposes of this discussion, we can call them patients, where we are supporting them towards their healing and helping them to gain their independence as fast as possible. Our process of care is mainly guided by the needs of the client and also by the management plan. We call it a care plan. So that is what guides what the caregiver is going to do.
Mm-hmm. Let's talk about you as a caregiver, Patricia. How do you feel about going into a home of a person that you know has tested positive for COVID-19? What PPEs do you and indeed your staff use to protect yourselves and indeed the patient as well?
Yes, of course. You know, many people forget that healthcare professionals are also human. So they will have a level of anxiety. But what again gives us the boldness to go is that we understand what it is that we are supposed to do. Much as COVID, the virus itself, is not very well understood, we know the basics of what we should do, how we can protect ourselves. We know that it is a highly infectious virus. We don't understand it completely, but when you talk about infection control, then that becomes a little easier to help the healthcare professionals. So the PPEs we are talking about very much depends on the symptoms of the client. I know there are those clients that are asymptomatic positive. Those then we will educate them. We will teach them on what it is they need to do. I know we are going to cover that. But those that have mild symptoms, then as a caregiver, you want to protect yourself, because you don't want someone, you don't want the patient to cough onto you and also coming into contact with the infected bodily fluids. So we will have gloves, we will have gloves, we'll have face masks, we are going to have goggles, you can have the face shield. And then if the patient is coughing or is sneezing, then you will wear the full PPE as we know it, the overall. Uh-huh. And it's also advisable to make sure that you have covered your hair as well. And that is something that many people are forgetting. You've got to get your hair covered.
Uh-huh. Right, you've got to get your hair covered. We understand that 78% of the infected persons are asymptomatic, Patricia. So as regards I know you've talked about the asymptomatic persons and how you as caregivers protect yourselves, but for those within the same home environment as asymptomatic persons, what are the critical things that they need to do to protect themselves?
One thing that I would like to inform our audience is that prevention of COVID must be very, very intentional. You must intentionally do it, because then if you get careless, you will definitely come across that. So when you're intentional about it, you're keen, you're looking and seeing what are the loopholes that, first of course, how is this virus transmitted? By bodily fluids. So how do I protect myself from the bodily fluids of the other, of my infected family member? So we are talking about cough. So I've got my mask. We are talking about saliva. So he has got to have his mask and I have got to have my mask. But remember, he is also using cutlery. How is it that we are going to share the same cutlery? We cannot share the same cutlery. So we've got to come to devise a way of disinfecting his or her cutlery. And we are talking about soaking it in Jik. Jik is very good in disinfection. So you've got to assign certain cutlery for this member of the family who is not well, so that then we are not transmitting the virus to other people. Then the bed sheets, also the beddings, have got to be washed on a daily basis, and also disinfected. So we are talking about intentional infection control. And I know we've got to educate our people a lot. And I want to commend the Ministry of Health, because even when they are giving their briefings, they throw in a bit of education. They tell you, do this and do the other. I want to commend them for that. But our people also need to pay attention and be very intentional about it. Diet is key, because like we are saying, we don't understand everything about this virus, but we know there's that which we know. And we know that a body that has got good immunity then will resist the infection.
Right.
So we've got to build our immunity.
Thanks for sharing that, Patricia. Let me rope in Daniela now. Daniela Munene is the CEO of Pharmaceutical Society of Kenya. Daniela, how costly is home-based care when it comes to COVID-19 treatment?
Well, Lillian, you could say there's an initial cost that's because you need a room that's separate from the rest of the household. So that has already to be in existence for you to be allowed to go on home-based care, preferably a self-contained room. But once you have that in place, it's really not that costly, because we are saying that people who are asymptomatic or very mildly symptomatic are the ones that are suitable to stay at home for home-based care. So these kind of patients, what they need is throat lozenges, like zinc lozenges, honey and lemon lozenges, to soothe the throat, not to cure the disease, but to soothe the throat. These patients will need over-the-counter pain and fever relievers, which are pretty cheap medicines. By the time you're thinking about more expensive interventions, then the person is already starting to be moderately or severely symptomatic, and they should be in a health facility. So it's really not that expensive. It's just that the infrastructure that needs to be in place already for you to be allowed to take care of yourself at home, your home needs to allow for that.
And we understand that there are those who require oxygen support and ventilators. Would you advise that patients actually be on oxygen support within their own homes?
That's a very interesting question, because our members at the Pharmaceutical Society of Kenya, those that are running pharmacies, they keep reporting to me that, patients are walking in and asking, may I have vitamin C? May I have some paracetamol? And may I have an oxygen concentrator? So we can sell you the paracetamol and the vitamin C, but certainly if you need oxygen, you need to be in a health facility. What we need to remember is by the time somebody is on oxygen supplemental therapy or mechanical ventilation in an ICU because of COVID, that ICU is not only giving the patient just the oxygen. There's a whole lot of other monitors, and a whole lot of other body systems that the health practitioners are monitoring. They're monitoring kidney function. They're monitoring acidity of the blood. So we don't just say you need ICU just for oxygen. You need a whole set of services and a whole set of different healthcare professionals. So let us not imagine that you can buy an oxygen tank or an oxygen concentrator. By the time you need that, you need to be in a hospital.
Right. And final question, Daniela, the recovery time for coronavirus patients that have tested positive for coronavirus that are on home-based care, what are the timelines?
The timelines are 10 days. So, in fact, the Director General of Health, he did well to educate us about this yesterday in the press release. So before, whereas we needed people to do a double negative test after they test positive, so we would then do after 14 days a test, and if it turns out negative, we still do another test, and then we tell the patient, now you're okay. But you see, as time goes by, we're learning more and more about the virus. And now we know that once you test positive, after 10 days, even though you still have the virus, it is not a viable virus and it is not infectious. So after 10 days, if your symptoms have disappeared, then you're okay. You can come out of your home-based isolation, and you don't necessarily need to do another test because the virus you're shedding at that time cannot infect other people.
Ladies, I thank you for your time. We are pressed for time, and unfortunately, I must let you go. Now, remember, it is World Breastfeeding Week, and the Ministry of Health recommends that mothers who are COVID-19 positive continue breastfeeding, irrespective of the fact that they've tested positive for COVID-19, while observing hygiene, while wearing a mask at all times. You are advised to continue breastfeeding your baby. We are going to be winding up now.